So, all right, let's get started. Let's talk about our Medical Monday. And I should probably have a little notepad here so I can keep track of who joins us today because I do love to give my shout outs. All right. Now my son says I sound like a little car that's trying to rev up when I try to clear my throat. All right, here we go. So this was from Samantha, our latest medical student that's volunteering with us. And she basically said, "Good morning, back with Medical Monday. And the topic for the week is coarctation of the aorta." That's going to be something interesting. So let's take a look at this visual here. So this is what a normal aorta looks like. There's the normal aorta right there, and there it is. And this is what happens when there's coarctation of the aorta. It's a narrowing that's created. You can see it right here as well. It's a narrowing that's created. So let's talk about coarctation. So coarctation of the aorta is a congenital condition, actually. So it's not something that you would develop. This is something that you would be born with, if it makes you feel any better. Kind of like a bicuspid valve. That does not just develop, that's something that you're born with. It's a congenital defect. And it's characterized by the narrowing of the aorta, which, as we know, is the major artery that carries blood from the heart to the entire rest of your body. And this narrowing can lead to various health complications if left untreated. So what would be the symptoms for somebody if they had coarctation of the aorta? Well, it really varies based on the severity of the condition, and common symptoms include high blood pressure. Seems to be a common symptom of just about everything, right? You could develop headaches, because if you remember that visual, that's kind of pretty close to the vessels that branch off to the arms and to the head. Muscle weakness, leg cramps or cold feet, nosebleeds, that's another one, or shortness of breath. So those are pretty common as far as symptoms that you would have. And in infants, severe cases might be presenting with pale skin, irritability, heavy sweating, difficulty breathing, and poor feeding. Okay, what are the causes? So the exact cause of coarctation of the aorta is unknown, but it's often present at birth. As we said, it's congenital. And in some cases, though, it can develop later in life due to a traumatic injury or conditions such as atherosclerosis or Takayasu arteritis. I don't know. It's good times, right? Trying to pronounce all these words. All right, so the risk factors, and there's several risk factors that would increase the likelihood of developing coarctation of the aorta, and they include it's more common in males, first of all, but that doesn't mean it wouldn't happen in females, but it's more common in males. If you have Turner syndrome, which is a genetic condition, Turner syndrome is actually more of a DNA type of, it's chromosomal in nature. So Turner syndrome only happens to females. This is my understanding. I'm not a doctor, but this is, if I'm recalling correctly, what I've heard. That could be a significant risk factor. Associated heart defects. So that'll often occur. This will often occur with other congenital defects, such as a bicuspid aortic valve, subaortic stenosis, patient ductus arteriosus. These are fun words. Atrial septal defect and ventricular septal defect. Gonna have to Google those words. All right, but if not treated, coarctation of the aorta can lead to several complications. So these can include chronic high blood pressure, and we all know what happens potentially with chronic high blood pressure. You can develop an aneurysm. Brain aneurysm or hemorrhage is another possible complication. Aortic rupture or dissection, heart failure or kidney failure. Even post-treatment, complications such as recoarctation, believe it or not, high blood pressure and aortic aneurysms can occur, necessitating lifelong medical follow-up. So the way that you would diagnose this would be a physical exam. So the doctor might detect a murmur or differences in blood pressure between arms and legs. And some of the diagnostic tests would include an echocardiogram, an electrocardiogram or ECG, an MRI or CT, a chest X-ray, or a cardiac catheterization. And the way that this would be treated kind of varies based upon the severity and the age of the patient. Medication tends to be prescribed, such as blood pressure, managing medications, both before and after a surgical intervention. And in infants with severe coarctation, medication can keep the ductus arteriosus open to allow blood flow around the narrowing until surgery can be performed. Surgical and procedural options. So there's several surgical and procedural options that exist to treat coarctation of the aorta. One would be balloon angioplasty and stenting. That tends to happen in a cardiac cath lab. And that would be a minimally invasive procedure to widen the aorta and place a stent. You can also do a resection with end-to-end anastomosis. That would be the removal of the narrowed segment and reconnection of the healthy parts of the aorta. There's also a subclavian flap aortoplasty. That's a new word for me. Using a portion of the subclavian artery to widen the aorta. You can do a bypass graft repair, which is rerouting the blood around the narrowed section. And that would be using a graft. And you can also do patch aortoplasty, widening the aorta with a synthetic patch. All right, if you're living with coarctation of the aorta, excuse me, patients with coarctation of the aorta require lifelong monitoring to manage blood pressure and detect potential complications. Regular exercise, careful consideration of pregnancy, and preventative measures against heart infections are important aspects of managing this condition. And coarctation of the aorta, it's a serious condition that requires prompt diagnosis and treatment to prevent life-threatening complications. Advances in medical and surgical treatments have significantly improved outcomes for those affected. If you suspect that you or your child may have this condition, you want to seek medical care promptly. That's all for this week. Have a great day. See you in 2 weeks, which will be next week for the next post. Thank you, Samantha. Always interesting to learn new stuff with big words.